My name is Phillip Stokes, and the title of my project is The Analysis of the Utilization of Advanced Directives by Primary Care Providers and Discussion of Barriers of Implementation. According to the American Medical Association, an advanced directive is a tool that allows patients to discuss their healthcare goals and treatments if they were not able to make decisions for themselves. Research has concluded only 36.7% of U.S. adults have an advanced directive. Studies have shown that 80% of the older adults wish to talk to their primary care provider about advanced directives, but only 7% have the discussion. The general practitioners found a lack of time, experience, and poor access to correct administrative requirements to be barriers for drafting and completing an advanced directive. Another study found patients' barriers for advanced directives to be lack of knowledge, inadequate understanding, and complexity of the document. The researchers identified 3 areas of intervention in the study, which were providing educational information using various methods of delivery, computer-generated triggers for primary care providers to initiate the discussion, and inclusion of multidisciplinary professionals to deliver the content and clarify questions. The Medicare program spent $740.6 billion on healthcare in 2018, compared to the $710.2 billion in 2017. The Medicare program spent 40% of the $740.6 billion on hospital care in 2017. In 2019, the average household who was on Medicare spent $9,533 on health care, compared to $4,700 in 2012. In 2019, Medicare spent on average $9,304 on Arkansas residents, which is slightly lower than the national average. In 2014, 2.6 million American people died, of which 80% were Medicare recipients. Over half of the Medicare beneficiaries who died were 80 years of age or older. The average spending on descendants on Medicare in 2014 was $34,529 per person. Most of the Medicare spending on descendants was inpatient hospitalization, which came to the average of $17,574. This is more than 3 times the amount spent compared to survivors on Medicare. The Centers for Medicare and Medicaid Services have produced guidelines that reimburse providers for having conversations about advanced care directives. This was put into place to provide an incentive for providers to initiate conversations with patients about advanced directives. Providers can use CPT codes 99497 and 99498 to be reimbursed. The relative value units, also known as RVUs for the code 99497, is 2.4 with an estimated payment of $85.99. And the RVUs for the code 99498 is 2.09 with an estimated payment value of $74.88. The purpose of the Quality Improvement Project was to see if primary care providers are having discussions about advanced directives to Medicare patients 65 and older. The objective of the study is to bring awareness of the possible lack of discussion of advanced directives to the patient population with Medicare who are 65 and older. The project was conducted at a rural clinic in Northeast Arkansas. The data was collected by performing a retrospective chart audit of 50 charts that was chosen at random from 350 charts. The inclusion criteria consisted of ages 65 and older, male or female. Primary insurance was Medicare and was seen in the clinic between January 1st to November 1st, 2019. The exclusion criteria was 64 and younger, was seen in the clinic outside the dates January 1st to November 1st, 2019, and primary insurance was not Medicare. The findings revealed only 14% of the patients' charts had CPT code 99497, indicating the provider had a discussion of advanced directives with the patient. The findings reveal what the literature review predicted. The results revealed support the findings that there's a lack of discussion and completion of advanced directives. The benefits of the study brought awareness to the site and the need to improve the discussion about advanced directives with Medicare patients. After discussing with the office manager, I suggested placing a reminder in the chart of Medicare patients with chronic diseases about talking about advanced directives. This would be a minimal cost, and the office manager said she would have to speak to the providers for making the change. There were limitations to the study because it only consisted of 50 charts in one clinic, so it does not reveal a true number of the population of Northeast Arkansas. APRNs can help increase the number of patients with advanced directives by asking them of their wishes if something were to happen. This gives the opportunity for the patient to have their end-of-life wishes protected and decreases unwanted stress of family making decisions for their loved ones. I would like to acknowledge my faculty mentor, Dr. Baltz, for helping me along my project. Thank you all for your time and allowing me to present my study to create AState.